Hi, I'm Colin Ong, and I would like to talk about the current shortage of doctors in Malaysia. Some of the information I'm given was from an article that I read that Malaysia has quite an acute shortage of maybe GPs, doctors. I guess when it's referred to the shortage of doctors, they're referring to the ones that are working in public hospitals. And many of people who cite not going into medical school is because the fees are expensive and the salary is very low for a typical Malaysian doctor, and it will take too long for them to even pay their university tuition fees. So I guess they're taking a loan and they're paying a very low, take time for them to pay for the tuition fees. And I feel that maybe they are also hinting that across the causeway, Singapore doctors in Singapore currency are getting paid much more. So this looks like a typical microeconomic essay where there's a breakdown in the price mechanism and the government should intervene, right? Because if you don't have enough doctors, the healthcare of Malaysia goes down, then many MNCs may not want to consider coming in Malaysia to set up base because eventually their staff will get sick. And if they keep complaining about the low service of the medical care in Malaysia, then they may not want to reside in Malaysia. They are not assured of that. So there are many factors that are connected with this story, and that's the reason why I like to talk about it. So if you're a student of economics, how do you approach it? Do you approach it where you raise the minimum price of visiting a doctor, or do you try to convince the doctors to use very cheap medicine and do a very fast kind of procedure, so that you can lower the fees? Or do you have a cooperative where maybe every patient will pay a certain sum of money, all right? And if they see a doctor, because they only see a doctor that's recognized by the cooperative, so it won't be so expensive. Or do you feel that maybe we do it like the McDonald's way? If you want to see, if your problem is not that urgent, go to this doctor. So this doctor earns by volume. All right, if you have slight flu, slight fever, go to this doctor. So you use artificial intelligence to decide. You're more complicated, go to this doctor. Or the last one, which the article didn't mention, is about artificial intelligence and robotic medicine, where you use robots to actually do some of the surgery, and the doctors may be doing multitasking, and they may use their mobile phone to conduct very simple surgery while his working staff starts to do the sewing. He doesn't need to do the sewing. So where do we start? So my suggestion is to start with AI. All right. You can't immediately ask Malaysians to start to run to medical school and then start a 6-7 year medical course. That is too long. So what you can do is that perhaps use AI to see at a certain time, at a certain year, are there certain kinds of sickness or diseases that affects people mass. So a very trained doctor doesn't have to see simple cases. So the AI is able to allocate. If you're a junior doctor, all right, you have 20 cases to do. Now they're not very tough because these are just normal, okay, flu medicine, MC, and all that. some cases are more advanced, then you go to this doctor. That means each doctor has a specialization, and the AI and the data analytics, I assume is machine control, is able to do everything and to cut down the time of processing the drugs. What the AI can do is that when the patient enters, it can do probability, that this is a probability you need this kind of drug. So what the machine will do is that even before the doctor writes a prescription, certain drugs are put in certain batches so that it's faster for the machine to get a drug, and the patient can go in and come out, productivity saved. And because the productivity is saved, the doctor is able to see more patients, and instead of seeing 10 patients, he's able to see 20 patients. So technically, it's like a pay rise. All right. So I feel that there should be more incorporation of AI to do what we call predictive analytics, to predict that when the patient comes, the temperature is this one. Okay. So the AI is always linked to all these medical stuff. So when he does the blood pressure, the AI knows it in real time, and the AI will do prediction that, okay, with this temperature, with this heartbeat, and with this history, 99% this person may need this. And then he'll inform the procurement, and will inform the pharmacy to get ready. And all this is in factories. This set, this block, there's a potential that XYZ needs with this. And then what they do is they start to pile up the drugs in a certain basket. And then what will happen is that before the patient gets a drug, maybe 30% of the drugs are changed or removed, and the patient is able to get the service he or she wants. So I personally feel that is one of the most important ways. Use AI, understand the patient, but of course the patient must allow the information to be given to the AI, because some people are scared of data leak. Number two, we should have a body of professors who assess the standard of healthcare in different countries, different hospitals, and maybe a Malaysian professor, a Singaporean professor, Thai professor, American professor, British professor. Everybody will stay in this group, and they will regularly assess the productivity and whether or not these healthcare, they are world class. So that whichever hospital you go to, they are certified, right? Best practice. So this could mean that perhaps the Malaysia on the one hand can invest in improving the infrastructure of its healthcare and attract people from different parts of ASEAN to come down to Malaysia. Maybe the currency is weaker, but the hotel stay is cheaper, and try to say that you're getting a Michelin star operation, a Michelin star recovery, but you're not paying a Michelin star hotel rate. And eventually there'll be parity. Some of the doctors from Malaysia will go to Singapore, may say that, hey, I don't mind coming back to Malaysia again. Now, if you like this kind of analysis, and you like to discuss with me about maybe pharmaceutical topics or aviation topics or even agriculture topics within economics, or you're a GP student who still doesn't understand how to answer a GP essay, please email me now, ColinOngTS@hotmail.com.